Hope your week is off to a good start. You're watching Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. Today, April 27, that is, marks the second anniversary of the Panmunjeom Summit, and we have several experts with us later on in the program to touch upon cross-border ties amid the COVID-19 pandemic. But first, here are the headlines with our Kwon So-ah and Noaram. Welcome.
Hello.
So let's start with you. How are we starting the work week?
Well, similar to the weekend, we have 10 new cases this Monday. So let's start off with today's daily figures. We have a total of 10,738 cases as of 12 a.m. And one more additional death has been reported, bringing the death toll to 243. More than 1,730 people are still in quarantine, while over 8,760 have fully recovered from the coronavirus. And as I said, the week began similar to what we saw over the weekend. In fact, 10 new cases were reported for 3 consecutive days since Saturday. Last week, we were hovering above and below 10. So in overall, the figures look pretty stable. And yes, those are the latest numbers.
Right, which is why, So we have our social distancing campaign eased, right?
Right, as the government's most recent extension of social distancing measures that are in effect until May 5th are a slightly relaxed version. It was the first time that this weekend we saw some relaxed measures at churches, which were open to the public, and Protestant churches, Catholic churches, as well as Buddhist temples resumed their religious activities, however, under strict quarantine measures. People had to sit apart from each other, which is why services were held more frequently a day than usual at many churches, and pre-registration as well as temperature checks were necessary as well. Now, while officials thanked the nation's people for such adjustments, there are concerns that further alleviation of social distancing has potential to result in new cluster infections, especially at nightclubs and bars. Recently, a 19-year-old who visited a nightclub in the southeastern city of Busan was confirmed with COVID-19 with the potential of having had contact with hundreds of people. There are still more than 100 being tested and in self-quarantine, while some are even unreachable. Now, although there are rules entertainment facilities are following, realistically speaking, it's not easy to prevent contraction from people who do not show symptoms at the period they were visiting such facilities.
Right. Meanwhile, I understand the global death toll has surpassed 200,000 as well.
Right. According to recent figures, there are now at least 206,000 COVID-19 cases around the world, and related deaths, that is, and with more than 2.8 million infections in total in some 185 countries and territories. And the U.S. has by far the largest number of accumulated cases, now 10 times more than the official number of the first epicenter, China. So for a closer look at the numbers, we are seeing now here the U.S. with more than 963,000 total cases. It also has the highest death toll at more than 54,000. The UK now has more than 20,000 deaths, just like Spain, Italy, and France, which are the worst hit European countries. Iran has over 90,000 accumulated cases, and Brazil, the hotspot in Latin America, has more than 61,000 official cases.
Russia, meanwhile, has recorded its largest number of daily cases, while in Spain, children were allowed to venture outdoors for the first time in 6 weeks.
Right. Well, let's start with Russia, which, according to officials, may see another spike in cases as public holidays are scheduled to start in early May, where many people usually take the entire week or more off to travel or spend family time, which is why officials warn that period is currently the biggest risk factor. Russia now has more than 80,000 cases, following a record 6,361 new cases on Sunday. Its death toll stands at more than 740. The capital, Moscow, is one of the worst hit areas, which is one of the many cities under strong lockdowns, with its citizens only permitted to go out to buy essential food or medicines, walk their dog, or take out garbage. And now moving over to Spain, one of the countries now seeing a slowdown in the spread. It recorded its lowest death toll over the weekend since the March 14th lockdown, and children were allowed to play outside for the first time in 6 weeks. Since Sunday, kids under the age of 14 were allowed outdoor activities between 9 a.m. and 9 p.m. under supervision. Adults can accompany up to 3 children who, however, are not permitted to play on playgrounds or share toys and have to stay at least 2 meters away from others. So despite these restrictions, it's nice to see the happy smiles on the children, and let's hope that these restrictions will be relaxed even further with lower cases in the future.
Of course, so thank you very much for that. Aram, there's been much debate between political parties over the government's second extra budget proposal. Will we see a consensus?
Well, we will find out maybe later today, or maybe, if not, in the next 1 day or 2. That's because Parliament has started reviewing the bill just hours ago, in fact. So earlier today, they are deliberating on the details of the emergency disaster relief money and how it will be paid, which now is to all citizens, which is a revision from the initially planned bottom 70% income bracket. The main opposition, United Future Party, is suggesting local governments adjust their expenditure to cover a portion of it rather than selling additional state bonds, which will put the country into further debt. Such conditions were agreed upon by the ruling Democratic Party, allowing for the review to start. Now, the government wants the bill passed by Wednesday, so in 2 days' time, to have the support payouts ready for May 13th, as the government had pledged. The second budget bill, which was originally some $6 billion, has almost now doubled to 11.6 billion. Moreover, the government is also planning to announce a third extra budget to support jobs, which could top $24 billion because a lot of jobs has been affected by this pandemic. Meanwhile, the government is also reviewing the possibility of students attending schools in person. In a separate note, Prime Minister Chung Se-kyun instructed education officials to prepare measures to ensure strict hygiene and distancing measures, so the government could announce a timeline for reopening schools as no later than early May. That is the kind of timeline they're looking at the moment.
I see. Now, despite the economic woes here in Korea, I understand the government is seeking to lend a helping hand overseas.
That's right. Finance Minister Hong Nam-gi says more than $400 million will be spent as an economic cooperation development fund to improve healthcare systems in developing nations. He didn't specify which nations in particular would be subject to the financial support. Korea will also be postponing debt payments worth $110 million for 26 nations. He also warned of a gloomy outlook for Korea as well during his press conference. He said Korea's export-reliant economy is expected to experience a, quote, big shock as the pandemic has crippled global trade. And Hong added that the government will preemptively cope with global economic uncertainties caused by the pandemic.
Now, regarding Seoul's efforts to help its global counterparts battle the COVID-19 pandemic, I understand it has a new standard in store.
That's right. Seoul is drawing up a global standard based on Korea's know-how on the fight against COVID-19. This will be presented to the International Organization for Standardization, or the ISO as it's known. The government said the guideline will comprise detailed measures used in the nation's drive-through and walk-through testing facilities, as well as those related to public medical facilities built to counter the outbreak. Once submitted to the ISO, the measures will be reviewed by experts around the world to decide whether to designate them as global standards. Korea's COVID-19 testing kit RT-PCR has already been voted and chosen, in fact, to become an international standard starting in November.
Well, that's good to hear. All right, Aram, thank you for that. It's time now for the regular afternoon briefing by the Central Disaster and Safety Countermeasure Headquarters on the COVID-19 situation here in Korea. The briefing today will be headed by Chung Eun-kyung, the head of the Centers for Disease Control and Prevention. Now, while the number of new cases in recent days remains within 10, health officials are advising members of the public to remain cautious, especially ahead of the start of what is being referred to as the Golden Weekend. We have now the briefing. We'll be back after it.
본부장의 설명이 있겠습니다.
Let us now begin our regular briefing on the coronavirus outbreak in South Korea. It's April 27th, and as of today, the total number of confirmed cases stands at 10,738. This includes 1,044 imported cases from overseas. Out of the total, 81.6% or 8,764 have been discharged following full recovery. And right now, we have a total of 1,731 people in quarantine under treatment. Yesterday, we had 10 new cases, and 7 of them were imported cases, while the 3 have been reported through community transmission. And yesterday, 1 more fatality was reported. I extend my deepest condolences to the deceased and the bereaved families. And the total death toll stands at 243, and the fatality rate stands at 2.26%. And looking at the sources of infection, we had 201 infections through the past 2 weeks, and a majority of them were regarding the imported cases, accounting for 60% of the total cases. And aside from that, we had cluster infections taking up 16.9%, and cluster infection in the hospitals and the nursing hospitals, accounting for about 20%, and we have 9 cases which are undergoing investigation, which account to about 4.5% of the total. And yesterday we had 7 imported cases. 3 were from the Americas, 2 from the Europe, and 1 from Japan, and 1 from Philippines, respectively. And regarding the latest cases, regarding the confirmed case in Daegu, we are currently doing the contact tracing, and we had 1 more case tested positive. And at Busan, we also had contact tracings and epidemiological investigations for the confirmed case, and about 140 people have been put on self-quarantine. And the clubs, as well as the other locations that this person has went, have been suspended of operation. And in Gyeongbuk Province, we have 1 additional case, and we have a total of 40 people tested positive at this cluster infection. And we also had 2 recent positive cases at the Myeongji Hospital in Gyeonggi-do Province, and we carried out an investigation, and about 43 people have been tested positive. And this person, the locations where these persons have went have been disinfected thoroughly, and we are also monitoring the conditions of others. And the countermeasures headquarters has its eyes on the next week, as it will be going through the golden holidays, and we urge the public to abide by the social distancing measures. We ask the public to refrain from non-essential travels and meetings, and if you have to go on travels, please refrain from group tours. And we advise you to be in small groups with family members only. And please refrain from going to crowded places where there are high risks of infection. And even if you go to tourist destinations, please keep 2-meter distance and wear your face masks, wash your face, refrain from touching your face with contaminated hands, and keep personal hygiene. And as for the nightlife venues that are difficult for ventilation, we ask you to refrain from operating. However, if you need to open, please check the body temperatures of all users and wear face masks and ventilate the facilities regularly, as well as disinfection. And if you have suspicious symptoms, please refrain from going outdoors or going to work, but get tested as soon as possible at our testing centers. And if you have close contact within the enclosed space, and if you have developed symptoms after that, or if you have 2 or 3 people at work or family units, please call the 1339 call center or the public health facilities and get screening as soon as possible.
오늘까지
Up until
1738명의
now,
확진자 중에
out
약
of the total number of
31%인
confirmed cases, about 31% have been discharged. 81% have been discharged. And we are seeing an on-day increase of about 10. And this has been stabilizing, and it results in, and this was all thanks to the dedication and the sacrifice put forth by the medical staff members. They are wearing protective equipment, and they are wearing the goggles, and they are sweating. However, they are still working at the forefront to fight against the virus. And we are also carrying out this encouragement relay campaign to pay our respect to these medical workers. And we ask for your participation in this campaign as well. And the KCDC also carried out this and participated this campaign, which is so-called Thanks to You campaign. And during the past 3 months or so, the medical workers have exerted their full efforts, and we also urge the public to show your respect through this campaign as well. Yesterday, 2 staff members, including from Myeongji, and a total of 7 so far, have been infected by the virus in the course of treating these patients. And then in the process of screening, we have 3 additional medical staff members who have been tested positive. And these people are always fighting at the front lines, and they are fighting against the virus to treat the patients, and it is our deed to provide our respect and gratitude to all of them. And we should also always encourage them, and the government needs to also pay its respect, and we need to intensify our support and recompensation for the medical staff members. Thank you very much.
사전에 출입기자단으로부터 받은 3가지 먼저 질문 드리겠습니다. 첫 번째입니다.
Right, that was the government's afternoon briefing, and I have Soa with a summary of the key announcements. Right, Soa?
Yes, KCDC Chief Jung Eun-kyung said we are seeing stable numbers when it comes to daily cases, as we have been seeing daily cases at an average of 10 in the past 10 days. And 7 out of recent 10 new cases were reported as imported cases. And she also mentioned that hospitals and other facilities where infections broke out earlier will be checked twice a week from now on. And she also mentioned that we are just ahead of the golden holidays, which is why she asked the people for not to go to non-essential travel, and also do not go onto group tours, and rather make their trips in small groups, just in small family members.
All right, Soa, thank you for that. We'll see you again tomorrow.
Thank you.
On April 27, 2018, the leaders of South and North Korea converged in Panmunjeom and shook hands at the military demarcation line, a long-standing symbol of division on the peninsula.
대통령께서 이렇게 분리선까지 나와서 맞이해 준 게 정말 감동적입니다.
In 2017 alone, North Korea conducted its 17 ballistic missile tests, as well as its 6th nuclear test, which was the largest it had carried out up to that point. Amid mounting tensions, the 2018 Pyeongchang Winter Olympics became a key turning point that opened a new chapter in inter-Korean relations. The two Koreas marched under one flag at the opening ceremony of the 2018 Pyeongchang Winter Olympics and fielded joint teams to compete at several events. This set in motion a quick warming of ties that eventually led to the historic Inter-Korean Summit in Panmunjeom just 2 months following the Games. The Panmunjeom Declaration included a 13-point agreement between the two Koreas, promising efforts to improve cross-border ties, alleviate military tensions, and build a framework for lasting peace on the peninsula. This historic meeting, coming on the heels of a decades-long history of war and confrontation between the two Koreas, marks their all-important first step towards a world of peace free from the spectre of nuclear war. In June of that year, the US and North Korea also held their first ever bilateral summit in Singapore in hopes of settling their relations, which had been steeped in hostility and tension for 70 years.
We've had a really great term together, a great relationship.
Amid the stalemate in nuclear negotiations between the US and North Korea, the leaders of the two Koreas met once again in Pyongyang in hopes of boosting momentum for further dialogue regarding the North's nuclear program. Following the sudden breakdown in talks at the US-North Korea summit in Hanoi, nuclear talks between the two sides were thrown into a state of deep freeze. However, 4 months later, on June 30th, 2019, the leaders of the two Koreas and the US held a surprise meeting at the DMZ in yet another effort to revive stalled dialogue. Despite these moves, relations between the US and North Korea have been stuck in neutral gear for nearly a year, while an uneasy lull has set in between the two Koreas as well. The South Korean government, however, is embarking on a new challenge amid the COVID-19 pandemic to make fresh inroads in its ties with North Korea, just as it did 2 years ago on April 2018 during the historic Inter-Korean Summit in Panmunjeom. President Jae-in is now looking towards cooperation in the health sector as a possible catalyst to revive inter-Korean dialogue.
이 감염병 확산에 남북이 함께 대응하고 접경 지역의 재해 재난과 한반도의 기후 변화에 공동으로 대처할 때 우리 결여의 삶이 보다 안전해질 것입니다.
Also, with the two Koreas marking the second anniversary of their joint Panmunjeom Declaration, South Korea is preparing to fulfill the promises outlined in that agreement, such as the Inter-Korean Railway project, among others. With South Korea's effective handling of the COVID-19 outbreak being looked to as a benchmark for other countries to follow, it is now seeking to leverage that as a means to revive inter-Korean relations through joint quarantine efforts and by providing much-needed medical supplies to North Korea.
April 27 marks the 2-year anniversary of the Panmunjeom Summit between the current leaders of the two Koreas. For more on the present and future courses of cross-border ties, I have Dr. Bong Young-sik from the Yonsei Institute of North Korean Studies. Welcome, Dr. Bong.
My pleasure.
And I have Dr. Ko Myung-hyun from the Asan Institute for Policy Studies. Welcome, Dr. Go.
Thanks for having me.
Dr. Go, Seoul's Unification Ministry has announced plans to revive the stalled Inter-Korean Rail project, which was one of the major agendas following the Panmunjeom Summit. What significance does this announcement have?
So even though the railway reconnection project seems to be a small piece in the overall grand scheme of the things, it's actually a very central piece in the ongoing South Korean effort to reach out to North Korea and then re-engage North Korea economically. The plan was outlaid a couple of years ago by President Moon himself under the moniker of the new economic map of the Korean Peninsula, where transportation reconnection between the two Koreas is a very, very important component in it. So the railway reconnection project, which actually was proposed back in 2018, and there's actually the first tentative attempt to survey the possible construction of the railway back in November 2018, but was interrupted since then. So this is actually a continuity of the project, and it was supposed to be the stepping stone towards a much bigger economic engagement, cooperation between the two Koreas, but was interrupted because the impasse in the dialogue between Washington and Pyongyang regarding denuclearization.
Various international sanctions on North Korea have hindered cross-border projects. Is this the case also with the railway project?
That was exactly the reason why it was interrupted back in 2018. Back then, it's still going on, but there was a so-called working level meeting between State Department and the U.S. State Department and the South Korean government, which actually discussed about the implementation of international sanctions against North Korea. And one of the key sanctions measures is the Resolution 2397 by the UN Security Council, which actually forbids member states from assisting North Korea with construction, and in addition to other industrial assistance. So in that sense, I think railway connection actually falls exactly under the rubric of sanctions that forbids member states from engaging North Korea with construction assistance.
Dr. Pong, how do you assess the current situation in North Korea amidst all talks between the two Koreas and, of course, the COVID-19 pandemic?
Well, it makes sense for North Korean authority to be more proactive in accepting the invitation by the Moon Jae-in government of South Korea to join hands for the inter-Korean economic cooperation projects more than ever because one, it is known secret that North Korea is not safe from the COVID-19 pandemics, and North Korea lacks the reliable medical facility or know-hows to tackle the problem effectively. But South Korea has emerged, as Arirang TV has series of the reports about the South Korea's response to the COVID-19 outbreak. So if there's any country for North Korean authority to turn to in dealing with the COVID-19 outbreak, that must be South Korea. And President Moon Jae-in repeatedly emphasized the willingness to render any kind of help for people and government in North Korea. That's one thing. And the railway reconnection project has been the hallmark of the Inter-Korean Economic Project by both authorities, as reiterated in April 27th first Inter-Korean Summit meeting between President Moon Jae-in and Chairman Kim Jong-un, and also reaffirmed in the Pyongyang Declaration. So if there's one economic cooperation project that has to be moving on, that must be as Dr. Go says, that this railway project. So although there are a lot of obstacles, like the conflicts and frictions with the United Nations Security Council resolution, and in the context of security alliance between Washington and Seoul, but at least South Korea can start this project in terms of survey and making preparatory steps inside South Korean territory, not over the DMZ. So it could be a good signaling to North Korea. And third, last point I'd like to highlight is the landslide victory in the National Assembly by the ruling party on 15th of this month. So now, by controlling 2/3 of the seats in the National Assembly, the ruling party can pass a lot of bills without having to worry about the opposition by the opposition parties to give the legal weight, authorization of the previous agreements made between two authorities.
And Dr. Pong, I'll ask you more about that later on in the program. Dr. Go, why do you suppose is North Korea then not responding to South Korea's offers of assistance?
Well, I think we've been discussing this the last week or so. I mean, the absence of Kim Jong-un in the public stage right now, that's one thing. And I think definitely North Korea is having trouble in coming out with a unified message or response to this kind of anniversaries and also as other events. We have to remember that Kim Jong-un was absent from the commemoration of the Day of the Sun, the birthday of the Kim Il-sung, the founder of DPRK, which he hasn't missed one single time before this year. So in that sense, I think there's something going on at the leadership level in the regime that's not helping or leading for the regime to celebrate the anniversary with South Korean government. In addition to that, I think domestically, I think the government of North Korea is distracted by the COVID-19 crisis. I mean, even though North Korea has declared that there's not a single case of infection in the country, the likelihood is that they do have widespread infection going on, just that they don't have enough infrastructure to tell how widespread the infection is or respond to this in a scientific manner. So that's the challenge that the North Korean government is facing right now, and clearly that's more of a priority for them to, rather than responding or engaging South Korea at the moment.
Indeed, a number of internal factors could be at play behind North Korea's lack of response. And for more insight, we have Dr. Jung Jiao from the Carnegie Tsinghua Center for Global Policy live on the line. Welcome, Dr. Jiao.
Thank you for having me.
It's been reported that China dispatched a team of medical experts to North Korea amid rumors over the North Korean leader's health. What are your thoughts on this?
Well, we don't really know much about the mission of the reported Chinese medical team. They could be there to help counter the COVID-19 situation or to treat Kim Jong-un personally. In fact, one of the first rumors that spread very widely on Chinese social media and then picked up by the international media about the possible death of Kim Jong-un was from some people in China who presumably has connections with Chinese doctors who serve on the team. So the further confirmation that China might indeed have sent a team to North Korea shouldn't be viewed as proof of the theory that something seriously wrong happened to Mr. Kim. That would be a circular argument to be made. But in either case, I think given how long Mr. Kim has not publicly showed himself and the possible fact that there were Chinese doctors there, there might be some health issues with him, but there is no way to confirm that the condition of Mr. Kim is very serious.
Which is why the speculation has been triggered that Kim Jong-un's sister, Kim Yo-jong, is being groomed as a possible successor. What are your thoughts on this speculation?
Well, I think his younger sister is the most obvious candidate to succeed Kim Jong-un in case something bad happened to him. She has, for some time, served as the de facto chief of staff for his brother, and she has gradually risen within the North Korean bureaucracy and has taken important positions. She recently was promoted to be an alternate member of the North Korean Politburo. So clearly, I think she is favored by his brother and could be a strong candidate. And according to some reports, she has a close family relationship with another powerful figure in North Korea, Mr. Choi Yong-hae, please excuse my pronunciation, which means she may feel even less internal opposition from other potential factions. But of course, one important factor is her view on important national security issues like North Korea's nuclear weapons, whether she would try to please the hawkish groups in North Korea to keep North Korea's nuclear weapons in future negotiations with the United States would be important for her to win support from the military and maybe also the defense industry, but we don't know much about her view on those critical issues.
Dr. Chow, going back to China's dispatch of medical experts, you mentioned this earlier. Do you believe that it might be more related then to the COVID-19 situation in North Korea? Pyongyang has thus far claimed to have no cases of the virus in its country.
I think it's certainly possible, despite North Korean claim of 0 confirmed cases in the country. It's hard to believe that's the case, given that North Korea is basically sandwiched between China and South Korea, 2 countries that saw serious outbreaks of the disease during the early stage of the crisis, of the global health crisis. And North Korea has taken a wide range of very serious measures to deal with COVID-19, the social distancing. They are closing down places. They are even using Zoom to have more online meetings than physical meetings. All those are evidence that they are taking a lot of sacrifice, especially economic sacrifice, to deal with the disease. If we consider how serious the domestic economic situation may already be as a result of international sanctions, it's hard to imagine that North Korea would be willing to take such additional economic crisis if the situation on the ground is not very serious. Another theory that is spreading is, that may be related is Kim Jong-un might simply be practicing social distancing by avoiding public appearance. That's a far-fetched theory, but I think it's possible that North Korean COVID-19 situation is not as optimistic as the government presents.
Dr. Chow, one final question. Today marks the 2nd anniversary of the Panmunjeom Summit, but inter-Korean talks have been at a standstill. How do you forecast the future course of cross-border ties, and what conditions might facilitate such interaction?
Well, I think North Korea very much wants to resume negotiations with the United States and maybe with South Korea as well, because it has an urgent need to get rid of the economic sanctions. And that's why I think North Korea in the past months has gradually stepped up its military provocations, launching more missiles in March than any month before. but this health incident might interrupt this process. But after the situation stabilizes a little bit in the future, I think it would still be in North Korean interest to step up its military provocations. The aim would be to impose more pressure and to gain more negotiating leverage in the future. Its North Korean plan, I think, is to force the United States and South Korea to relieve more economic sanctions. How much North Korea is willing to completely trade away its nuclear weapons in doing so is uncertain, but it certainly aims to drive to achieve the biggest negotiating leverage by a more coercive diplomacy.
All right, Dr. Jiao, thank you very much for sharing your thoughts with us today.
Thank you for having me.
Dr. Ko, what are your thoughts on Dr. Jiao's views regarding the conditions that might facilitate cross-border talks?
Well, clearly right now there's a new condition for the the re-engagement of inter-Korean relations. Before it was actually a political agreement between the two Koreas in the sense that North Korea had been asking South Korea to essentially help North Korea to evade sanctions, or maybe asking South Korea to somehow convince the United States to lift the sanctions currently in place against the country. But now there's a new condition. I mean, this is unexpected, and the condition is actually getting rid of or controlling the COVID-19 outbreak that's potentially going on, raging actually in North Korea at the moment. So that's going to require North Korea to reach out to South Korea with health assistance, public health assistance in this case. And obviously there's always China and Russia on the other side, always ready to step in to help North Korea in this regard. But I think North Korea has seen that how successful South Korea was in dealing with the COVID-19 situation. It's being considered as a role model of how to respond to this kind of infection and outbreaks. So I think North Korea cannot ignore South Korea anymore. And also, South Korea has been on standby to help North Korea in all aspects of public health assistance. So North Korea knows that there's actually a blank check right now on the table for North Korea to take it. And I think North Korea might be very tempted to take this check and use it. So I think it's just a matter of, it's a matter of saving the face for North Korea. North Korea was very much invested in this strategy of essentially sidelining South Korea in the negotiation with the United States throughout last year. And now they have to do an about face, but they need time for that. And I think they're going to come up with an argument to somehow justify their change of strategy or change of approach to South Korea, and that's going to take some time.
Dr. Bong, let's go back to what you mentioned earlier. The ruling party secured a landslide victory in the general elections. Do you see this reality as providing the Moon administration with further momentum, perhaps, to push forward with its peace initiative on the Korean Peninsula?
Definitely, because when you control 2/3 in the National Assembly, then you can combine the power of the administrative branch of the government and the legislative branch of the government. But the key issue is, as Dr. Go correctly mentions, how willing a North Korean authority will be in terms of accepting outside support, medical support in coping with the COVID-19 outbreak. So far, the official position of Pyongyang is that there is no patient at all. And so admission of the situation on the ground is the first step that has to be made by top authority of North Korea. But I think North Korea will do that because just demonstrated by the self-isolation of top leader Kim Jong-un. Kim Jong-un has to deal with this problem urgently because this is not just a national crisis, but direct threat to the very life of the top leadership. He's vulnerable to this outbreak, so he has to have any kind of help that is necessary to protect himself. So I think there is a high probability for Kim Jong-un government to be really flexible in dealing with South Korea compared to its previous dismissal of the Moon Jae-in government. And I'd like to make a comment about the status of Kim Yo-jong as a likely successor. I think there's an exaggerated expectation about her because she is only in early 30. She has not received any training, official training to be the next leader of North Korea, compared to her brother Kim Jong-un, who had received a very detailed and systematic training and tutelage by dying father for 3 years before he emerged as the official leader of North Korea in 2011. and so did his father, right? Served under the great leader Kim Il-sung since 1972, before he replaced him as the second leader of North Korea in 1994. So I don't think it makes any sense to expect Kim Il-sung to succeed Kim Jong-un if there's any emergency happening to Kim Jong-un, because Kim Il-sung is not prepared. She's too young, and I'm sorry to say this, but North Korea is a feudal system when it comes to gender equality or respect for women in power. So I like to bet that it is more likely for Kim Jong-un's uncle, the former North Korean ambassador to Czech Republic, Kim Pyong-il, who got summoned to North Korea last year to be the next, at least interim period of time, next leader of North Korea, if there's anything happening to Kim Jong-un. It's not going to be Kim Il-sung.
I see. Dr. Pong, one question regarding inter-Korean ties again. Seoul has voiced intentions to revive individual tourism to North Korea. How feasible is this plan?
It is feasible as long as the individual tourists from South Korea would not provide North Korea so-called bulk cash, right? If they just use their own personal money in small amount, then I don't think it'll be very difficult for outside authorities to accuse South Korean tourists for violating United Nations Security Council resolutions. But more important leverage lies inside North Korea. North Korea's eyes are not on tourist program revived with South Korea. North Korea wants those individual tour programs to start for Mountain Kumgang and Kaesong, because North Korea would welcome any kind of revenues. But North Korea's eyes are on bigger prizes, which is lifting United Nations Security Council resolutions. Because resuming export of coal, minerals, fishery products, textile products are bigger prizes compared to stream of small amount of money spent by South Korean tourists. So yes, North Korea welcomed this, but North Korea's focus will be on the United States action in terms of relaxing United Nations Security Council resolutions.
Just out of curiosity, these individual tourism or these tours do not violate sanctions against North Korea?
Well, it's a matter of interpretations, but for instance, in 2018, within the purview of United Nations Security Council resolutions, Chinese government sent about 1 million Chinese tourists. And on average, each Chinese tourist spent about $300 during their visit to North Korea. So it helped North Korea to overcome the balance of payment problem, because it amounts to $300 million in year. So North Korea would expect the same revenues from South Korean tourists.
I see. Now, before we continue with our studio discussion, let's listen in on the thoughts of experts in the US regarding the resumption of joint military drills between Seoul and Washington amid speculation of the North Korean leader's health.
I think the evidence suggests that that's not the case. If you recall, President Trump unilaterally halted U.S. exercises for almost 2 years, and there was never any reciprocity from the North Koreans. Refused to meet with us at the senior working levels, and continued to do a rash of ballistic missile tests, which they've continued even through the coronavirus crisis. So, and not only that, but they've also continued, they've also gone ahead with their own military exercises during this time. So they will always complain, and it always makes them nervous. But I don't think there's any reason to believe that if we stopped, they would change their behavior.
Yes, I think that Kim Jong-un's health and his future as leader of North Korea are both very important, partly because the relationship between North Korea and the United States is now so personalized in the relationship between Donald Trump and Kim Jong-un. And if somehow the leadership in either country were to change, that could really affect things tremendously. On the other hand, I should also say that right now, it seems like North Korea-U.S. negotiations have really bogged down, that they have reached an impasse. And so it's possible that Trump and Kim are not really going to achieve anything anyway. And in that sense, maybe a new leader in North Korea wouldn't make much difference. But we still have to worry about turbulence, about instability in any nuclear-armed country. So in that sense, until any kind of successor were clearly established for Kim, it would be a very tense and fraught situation.
Now, that is indeed a very grim outlook. What are your thoughts, Dr. Go?
Well, I think what's going on is that the COVID-19 actually took over everything in the Korean Peninsula. I mean, we know that North Korea took tentative steps towards escalating or carrying out its provocation roadmap at the beginning of this year. And in fact, Kim Jong-un's last sightings included his participation in fire exercises. And at the same time, there's some expectation because of that some quarters, experts in Washington and Seoul expected North Korea to respond to the current, the joint military exercise between U.S. and ROK with an even bigger provocation. But because of we don't know exactly what's going on at the leadership level in Pyongyang right now, but it looks like a COVID-19 took over the decision-making process in North Korea, which actually precluded North Korea from responding to the joint military exercise in a way that many experts expected. So I think after this COVID-19 situation stabilizes, then North Korea will retake the previous course of pre-scheduled course of a provocation roadmap, taking into account the necessity for expanding the public health exchange, cooperation between the two Koreas.
Dr. Bong, in your opinion, what role can Seoul play perhaps to improve ties between Pyongyang and Washington?
Well, at the beginning of today's discussion, we kind of agree that the President Moon Jae-in will be determined to galvanize the momentum for inter-Korean talks and economic cooperation. And it is very likely for him to announce and defend so-called the creation of peace economy, the joint inter-Korean economic zone, as a substitute for Korea's dependence upon Japanese economy. But I don't know how much public support and endorsement will it get from the public, because on one hand, Korean public would agree with that idea because it is very likely that Korean economy will be going through kind of crisis because COVID-19 outbreak. But on the other hand, Korean public may protest that we have to save ourselves first. Not North Koreans. So it'll be very controversial political topic in near future.
Right, we'll need a stronger balance then. All right, Dr. Bong and Dr. Go, thank you very much for your thoughts today.
Thanks for having me.
Now, that is all the time we have for today. And starting from today, for our viewers here in Korea, you can purchase 3 masks per person as opposed to the 2 masks per person policy. In the meantime, do be sure to share your thoughts and inquiries with us through our social media accounts or our homepage, arirang.com. Thank you for watching.